Hello A&P students, this is Mr. Becker here to talk about the arteries and veins of the gastrointestinal tract. So here you can see our real life torso is fully intact currently, and so as I kind of pull pieces apart, I'm going to be moving back and forth between them to kind of go down this list. And so the very first thing that I'm going to do is pull the stomach and the liver, and then the entirety of the actual organs of the GI tract. So we can take a look at the aorta. And so if we take a look, we had the descending aorta, or the thoracic aorta, through here. You can see the ends of the diaphragm located right here, and this is the aortal hiatus that we were passing through. All right, so we have three vessels that are going to the GI tract that are located along the midline of the aorta. We have the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery, respectively. All right, so each of these is going to branch to give us differing sets of vessels that we have to be able to identify. So the first one that we have is the celiac trunk. So I'm going to lift you up so that way hopefully we can kind of see in here. The celiac trunk gives rise to three primary vessels. We have the left gastric artery, the common hepatic artery, and the splenic artery that are going to come off. All right, so the easiest of these is the splenic artery. It comes this way and goes straight to where the spleen would be located right here. All right, so that's going to give rise to one blood vessel. All right, so we have this side right here, the left gastroomental artery. That's going to branch off of the splenic artery, and it is going to run down the left side of the greater curvature of the stomach. All right, so the proper hepatic artery is the other one that's being shown here. I'm sorry, common hepatic artery. Let's do these in the right order. All right, the common hepatic artery comes off of the celiac trunk here and is going to go to a branch point right here. All right, this branch would then come up here and go to the underside of our liver. All right, this branch is the proper hepatic artery that's going to lead into the liver itself. And then on our other model over here, you can see the end of the proper hepatic artery located right there before we form the left and right hepatic arteries. All right, so coming off of that as well, right, moving this way and then branching onto the top of the gallbladder is the cystic artery. And so this set of red is the cystic artery. All right, so the final branch that we have coming off of the common hepatic artery here is the right gastric artery, which is going to come off of our stomach in the lesser curvature. So if I tilt this forward, like so, and now we're kind of looking at it from the back, from this side right here, which would be the right side. This is the right gastric artery coming from here. All right, so the other main branch of the celiac trunk can't be seen on the main model here. They put the branch of it right here. This is the left gastric artery coming down. So between the right gastric artery and the left gastric artery, we form the two gastric arteries that are found in the lesser curvature of the stomach. All right, so the next main branch that comes off of the common hepatic artery is the gastroduodenal artery that comes down here. The gastroduodenal artery is going to have a couple of branches on it. The first of these at the end right here, kind of tilted down, is the superior pancreaticoduodenal artery. Probably the biggest mouthful that we're going to make you say when it comes to blood vessels. And then the second vessel coming off, instead of coming off of the left side of the stomach here, coming off the right side of the stomach, and moving through the greater curvature this way, is the right gastromental artery. So you can see the stomach actually has 4 vessels. We have a right gastric and a left gastric for the lesser curvature, and then we have ourselves a right and left gastromental artery that are going to serve the greater curvature, but where they come from will vary quite a bit. So, put this back down, hopefully. The next main vessel to come off of the abdominal aorta is the superior mesenteric artery, located right here. And that one its other end is located right here, going past the pancreas and then coming out this way. All right, so we have a couple of vessels that branch off of the superior mesenteric artery. We have the middle colic artery right here. We have the right colic artery located right here. And then we have the iliocolic artery located right here. And then coming off of this on both the superior and the inferior mesenteric arteries, we can see all of these branches along the length. These are what we call the intestinal branches. They're leading into the small and the large intestines. Finally, our third vessel that comes off of the abdominal aorta right here, there is the inferior mesenteric artery. So we can go back to our thing here. The other end of the inferior mesenteric artery is located right here, directly below the duodenum. So the inferior mesenteric artery has several branches to it. So keep in mind we're looking at this from the back side. So this is the left colic artery being shown right here. We have the sigmoid branches. So this entire loop right through here is the sigmoid branches. And then you can see this branch coming off and moving this way toward the rectum is the set of rectal arteries located right there. We have one final artery that's an important anastomosis. The real-life torso doesn't show it very well, so we have to go to the red torso's mesentery to look at it. If we take a look, we can see over here the middle colic artery right here. We can see the iliocolic and the right colic arteries over here. This vessel right here that's coming up and coming over actually comes over and then would join over through here. So we have a segment of the marginal artery, or the artery of Drummond, located right here. This joins the superior and inferior mesenteric arteries in an anastomosis, and it's an important one for the GI tract. That is the marginal artery of Drummond. All right, so finally we have some of the veins of the GI tract. All right, so we have 4 veins that are going to collect up a majority of the blood from the GI tract, and for the most part they parallel the arteries that we see on our models as well. They don't represent some of the smaller ones, but they do represent some of the larger ones. There's a small problem with the real-life torso, and I don't think that the red torsos do a super good job of this either. All right, so if we take a look here, we can see the superior mesenteric vein, and then next to that we have the inferior mesenteric vein, and here's the splenic vein. The key problem with this is that the inferior mesenteric vein directly drains into the splenic vein. It doesn't come straight into the hepatic portal vein. So this is the hepatic portal vein right here. So this particular orientation isn't common in humans. The inferior mesenteric comes straight up to the splenic, and then the 2 branches that form the hepatic portal vein are the splenic vein and the superior mesenteric vein. So something to kind of be aware of, but we can see all 4 of the veins represented here.